Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at FuncPhysio. Today I'm going to talk about pain with sex. So pain with intercourse is actually quite common in women. Research says somewhere between 2 in 10 women or 1 in 5 women have painful sex at some point in their life. Because it is so common, sometimes women think that it is normal, and it's quite prevalent for them to think it's normal when they're younger years. So younger women sometimes think that it's normal to have pain with sex. Well, before we go over why sex can be painful, let's put one thing out there. Pain with sex is not normal. Pain with sex is never normal. It should not hurt. There should be a sensation of pleasure. There should be a sensation of satisfaction. There should be no sense of pain with sexual intercourse. So now, why sex can be painful? We can go over a few reasons. One of the common complaints to gynecology office is when they do a pap smear, there is pain. There's a lot of pain with pap smear. If there's a lot of pain with pap smear, there is likelihood that you have pain with sex as well. You should talk to your gynecologist to begin with if you have painful sex, because there could be cysts, fibroids, infections, and other organ-related diseases in the vaginal canal or in the reproductive organs that may be causing your pain. So first step is to tell your gynecologist, discuss with them. But if all the tests are normal and all the organs look okay and the vaginal canal looks okay and there are no infections, then the next step is to think about what can be there that's not organ related in the pelvic cavity that can cause pain. So to explain that, here is a pelvis, and I'm going to walk a little bit closer. Here is a pelvis, and when we look inside the pelvis, there are organs. This is the bladder, this is uterus, and rectum in the back. When we take these organs out, there is a huge muscle inside the pelvis. This muscle is called pelvic floor. Pelvic floor is a bowl, like a hammock-like muscle that sits inside the pelvis. And now, if we flip this over, you can see these 3 openings: the vaginal opening, the urethral opening, and the anal opening. And what it is vaginal canal is an opening in the pelvic floor muscles, part of it anyways. So the whole vaginal canal is a muscular layer. So if there is pain with intercourse, a lot of times it is because this muscle is either too tight or in a spasm, or just lacking flexibility and coordination. So, and there has to be no specific injury to pelvic floor. We see again and again that sometimes pelvic floor just has a spasm and is tight or is painful for no apparent reason or immediate injury. Sometimes it just happens. So if there is painful intercourse and all the organs are okay, we can think, or we can look into this muscle that might be tight or might be too lacking flexibility and coordination, which is causing your pain. Patients where all the organs are okay, the next step is to check this pelvic floor, and very many times, quite often, it's this pelvic floor that's causing the pain and not the organs. So if you have pelvic pain and painful intercourse, talk to your doctor. If your organs are okay, find a physical therapist who can look at this muscle and see if this is causing your pain with intercourse. As always, do not accept that painful intercourse is normal, because it is not. It is not normal.